I want to talk to you about the biggest mistake people are making using NFP or natural family planning. My name is Dr. Olivia Joseph, and I've been practicing in functional medicine for 20 years. Working with women with hormonal imbalances is a large part of my practice. Today, I want to talk to you about NFP. So NFP or natural family planning is a method to prevent pregnancy that could be as effective as 91 to 93%. But what I find is that high success rate is typically found in people who are working with an NFP practitioner. I am not an NFP certified practitioner. I'll tell you that right now. I work with balancing hormones and hormonal imbalances naturally, but I refer out to natural family planning practitioners because I believe in its effectiveness and I believe in its safety. What you need to know about NFP is it does take several months to fully understand your cycle and when you are most and least fertile. So we use NFP not just for preventing pregnancy, also for conceiving and also for hormonal imbalances and helping to identify who might benefit from some natural hormone replacement therapies such as progesterone. So NFP, and there's another method out there called the Wiley method that is used a lot to help women with hormonal imbalances. It's important to understand how your hormones work, not just for fertility outcome or preventing pregnancy, but also to know if you have a balanced hormone system. What I would suggest is hook up with an NFP practitioner, and I would also recommend you get an app called Natural Cycles app. And this app will help you to track different signs and symptoms. You're gonna need to take it a step further. To do NFP right, you're gonna have to do some charting. And sometimes that means you have to chart things like cervical mucus. Sometimes you have to chart things with mood. You definitely have to chart cycle length, when you have cramping, if you see spotting, things of that nature. Another important thing is body temperature. So you can do your basal metabolic rate, which is checking your body temperature. Initially, you'll probably need to do it every day. But after a few months of getting to know your cycle, you'll be able to do it only at a specific time in your cycle. These are going to show you the signs and symptoms of when you're the most fertile, whether you're trying to conceive or trying to prevent a pregnancy. And what you really need to learn about your hormones and your hormone system is, are you seeing the same patterns month after month after month? You should be. That's healthy, because if you have abnormal cycles, if you have a short cycle length and then a super long cycle length, you're gonna have a really hard time with NFP. But the thing is you likely have some type of hormonal imbalance that could be causing these symptoms and causing these cycle abnormalities. So what are some things that are gonna mess with NFP and cycle abnormalities? One is gonna be PCOS or polycystic ovarian syndrome. With PCOS, you're typically anovulatory. So if you're struggling with infertility, if you're having a really hard time getting pregnant, if you have a really long cycle length, like 40 days, 45, you might have issues with polycystic ovarian syndrome. Now that used to look like women who were overweight, diabetic, had dark hair growth. It no longer looks like that. Since the introduction of high fructose corn syrup and many artificial sweeteners and toxins, we've seen high insulin levels in people who aren't even overweight, high A1Cs, abdominal obesity. Another common hormone pattern you see with PCOS is low progesterone and or high testosterone. So if you do have low progesterone, you're going to want to know that if you're doing NFP, especially if you're doing it to conceive. But if you have low progesterone, that might be throwing off some of these signs that you're trying to monitor about when you're most fertile. So what I would suggest is, if you work with an NFP practitioner, they're going to be able to test your hormones. Another thing that can mess with your cycles and tracking is very heavy periods, breakthrough bleeding. That's going to make it harder to chart. And if you have issues with fibroids, endometriosis, very heavy bleeding, anemia, really bad cramping, this may be an underlying hormonal imbalance of estrogen dominance. So another thing you can look for is androgen dominance. You can have things like DHEA tested. And when DHEA is really high, that means you're androgen dominant, and that's going to be more likely with a polycystic ovarian syndrome. A lot of women with PCOS also have issues with acne, not just on their face, maybe on their chest or on their back. They may have issues with ovulation. They might have longer cycle lengths. They might store fat in their belly. So these are things that need to metabolically be corrected. NFP is an amazing method. It's not just about fertility and how highly successful it is. It's about getting to know your body, your hormone system as a woman, and it can help you identify and detect underlying hormonal imbalances that might be there. And that's going to affect the effectiveness of your NFP. That's also going to impact your charting, and that's something you're going to want to get to the bottom of. So working with a functional medicine practitioner who specializes in hormones, working with an NFP practitioner if your goal is specifically fertility, is highly recommended and could be really useful for you. One thing I would like to add to that is some of the best tests if you do suspect a hormonal imbalance, or if you're struggling with infertility, or even if you've conceived at really, really weird times when you shouldn't have been fertile. These are signs that something might be off, right? I'm a huge fan of Precision Analytics Dutch Complete Hormone Test. That's what I do on 99% of women in my practice. But one of the best tests for cycle mapping is actually their cycle mapping test. So if your hormones are all over the place, an NFP practitioner might be working with your blood levels as well as all of these other signs your body is showing, but you can actually do a cycle mapping test with Dutch Precision Analytics, and I've done this for a lot of women struggling with fertility. If you need help with your hormones and you want to approach it by getting to the root cause and looking at things naturally, feel free to reach out with my team at The Wellness Connection. Myself and my functional medicine practitioners would be more than happy to help you. And if you are looking for a natural family practitioner, there is a directory out there that can help you find one near you.